A sore throat caused by a bacterial infection, or strep, can often be the cause of more serious medical problems. Reporter Laura Windsor has more.
Strep throat is one medical condition that shouldn't be treated with home remedies. This needs to be evaluated by a physician because untreated strep throat can cause kidney inflammation and rheumatic fever. We spoke with Dr. Michael Gatto of Desert Regional Medical Center in Palm Springs to find out more.
Strep throat is a bacterial infection, and it's usually tonsillitis. So tonsillitis and strep throat are pretty much one and the same. People that have tonsils will develop an acute infection. It's a bacterial infection, and it's caused by streptococcus, which is a very common bacterial infection, and it's treated with antibiotics. Tonsils are lymphoid tissues, so we're born with certain tissues that produce lymphocytes, the cells that fight viruses. We're born with lymphoid tissue throughout our body. Tonsils are located in the oral cavity, and in uterus they help to make lymphocytes. As we get older, they're worthless, and all they are is a reservoir for bacteria. So normally after 3 or 4 years old, it's benefit to get your tonsils out if you're having infections. People that have tonsils will notoriously carry bacteria from one person to the other. So people that don't have tonsils pretty much will upset that cycle. So it's the people that have tonsils will keep spreading it to each other, and that's what kids get a lot of it, and teachers get a lot of it because it's really brought on by mostly children. Once you get your tonsils out, it breaks that cycle. Tonsils are a reservoir for bacteria, so when your resistance goes down, the level of bacteria rises, and you wind up getting an acute infection.
Dr. Gatto, how serious can strep throat get?
The worst scenario with untreated bacterial tonsillitis is that it can turn into a cellulitis and then turn into an abscess, and it's what's called a peritonsillar abscess. Once it gets into the muscles of the palate, you wind up with a pretty significant infection, and what you think is a sore throat, what you've had as a sore throat, is multiplied by 100. Peritonsillar cellulitis is not only very painful, but it also makes you extremely sick, gives you a high temperature, and can lead to oral airway obstruction. So it's something you want to treat. And if you're getting multiple episodes of bacterial tonsillitis, you should have your tonsils out. The criterion is anything more than 4 infections in a year period of time, or an infection that doesn't go away in a month's period of treatment is an indication to get your tonsils out. That sore throat is worse than the infection sore throat. However, when it's over and it lasts, you have a sore throat for about 2 weeks or so, and then by about a month, when the tonsillar fossa, the fossa that houses the tonsil, closes, then you're done. Most people that have had their tonsils out do not get infections.
If throat pain and discomfort are persistent or seem to increase in severity, it's important to see your doctor. For the American Health Journal, I'm Laura Windsor.